Welcome back to Scalia.com. My name is Muhammad Osama, and today we are talking about the vascular system and its pathologies. And this topic is about the aneurysms, in which we are going to talk about what is aneurysm and what are the types of aneurysms and what is arteriovenous fistula. So let's start off with what an aneurysm is. So it is actually a localized abnormal dilatation of the arteries or veins, and it can also erode the adjacent structures or it can also rupture, as you can see here in a ruptured aneurysm. So these are aneurysms which are not ruptured, so they can either be saccular or fusiform, as you can see in these pictures, and they can also be ruptured and resulting in hemorrhage into the surrounding tissue. Now, what are the different types of aneurysm? So namely, there is the atherosclerotic aneurysm, aneurysm due to cystic medial necrosis, Barry aneurysm, syphilitic aneurysm, dissecting aneurysm, and arteriovenous fistula, or it is also known as arteriovenous aneurysm. So let's start off with the atherosclerotic aneurysm. So atherosclerotic aneurysm, obviously, it is obvious that it is because of the atherosclerotic plaque or atherosclerosis, or it is secondary to atherosclerosis, and it is most frequently found in the descending aorta, especially in the abdominal part of the descending aorta. So here you can see this is the abdominal part of the descending aorta, and this is the normal aorta, and if the dilation of this part occurs, then that would be the dilation of the abdominal aorta, and it would be a type of atherosclerotic aneurysm. The second is the aneurysm due to cystic medial necrosis, and this occurs most frequently in the aortic root. So here you can see that this is the ascending aorta, and then this is the descending aorta, and this is the aortic root. And here you can see that there is actually aneurysm in the aortic root and the ascending aorta as well. So this is an example of aneurysm due to cystic medial necrosis. So moving on, we have the Barry aneurysm. So Barry aneurysm is actually small saccular lesions most commonly seen in small vessels of the brain, especially the circle of Willis, which is present on the underside of the brain, as you can see here. And you can see an enlarged image of that circle of Willis, and here you can see this is an abnormal dilation which looks like a Barry. That's why it is called as Barry aneurysm as well. So this Barry aneurysm on the anterior communicating artery of the brain is actually characteristic feature of the Barry aneurysm. So it is not present at birth but develop at sites of potential weakness or at bifurcation of the cerebral arteries. Cerebral arteries are the arteries which are actually supplying the cerebral hemispheres of the brain, so they are very important, and if their blood supply in that area is problematic or it is occluded, then it results in stroke or cerebrovascular accidents. It is often associated with adult polycystic kidneys, and Barry aneurysms frequently rupture and bleed, and that is why they are the most frequent cause of subarachnoid hemorrhage in the brain. Now, secondly, we have the syphilitic aneurysm. It is actually caused by the bacterial infection and it is actually the manifestation of tertiary syphilis and caused by syphilitic aortitis, which is the inflammation of the aorta secondary to syphilis, characterized by endarteritis of vasa vasorum and necrosis of media or tunica media, resulting in a tree bark-like appearance. Now, what is vasa vasorum? Vasa vasorum are actually the blood vessels which are actually supplying blood to the lining or the layers of the artery or the arteriole, such as tunica adventitia and tunica media. So the endarteritis of vasa vasorum would actually then lead to the necrosis of the tunica media, because those smooth muscles in the tunica media would not get their nutrition and blood supply via the vasa vasorum. And this may lead to aortic valve insufficiency as well. The second is dissecting aneurysm. This is different from other aneurysms because in a dissecting aneurysm, the wall of an artery rips longitudinally or dissects longitudinally, as you can see in this picture. So there's a longitudinal dissection along the length of the vessel or the artery or the arteriole. And this occurs because bleeding into the weakened wall splits the wall and the blood enters into that tear. So dissecting aneurysms tend to affect the thoracic aorta most commonly, and they are typically associated with hypertension because greater blood pressure can actually cause a dissection in the weakened blood vessel walls, and also associated with cystic medial necrosis, but they do not have any association with the atherosclerosis. Now, moving on to the last type of the aneurysm, which is also known as fistula or the arteriovenous fistula. Fistula is actually a communication between two compartments or two regions between which a natural communication does not occur. And this abnormal communication results in the formation of a venous aneurysm. How does that occur? Let's look at it into the detail. So an arteriovenous fistula is an abnormal connection or passageway between an artery and a vein. So that is why called arteriovenous fistula. Now, it can be secondary to trauma or other pathological processes that mechanically penetrate the walls of both vessels, resulting in direct communication between the two. So it may result in ischemic changes due to diversion of the blood via the arterial pathway to the venous pathway, and thus impaired blood circulation. And this increased pressure because of this disruption of the arterial blood to the venous blood or shunting into the venous pathway, resulting in increased venous pressure, resulting in ballooning and aneurysm formation in the vessel or the vein, as you can see here. So this is normal, and as you can see, there's thickening of the vein. Now this is known as the arteriovenous aneurysm, and you can see there's mixing of the venous and arterial blood. So this arterial blood, instead of going all the blood going here and coming back to the vein, is actually shunting into the vein here and causing increased venous pressure, resulting in swelling and dilation of the vein, resulting in arteriovenous fistula. And it may also lead to high output cardiac failure from hypervolemia. So in this part of the vascular system, we talked about aneurysms, type of aneurysms, and arteriovenous fistula. And I hope you learned something out of it. So keep on watching scardia.com and stay tuned for more lectures in this series. Thank you very much.